Foundation Module 9 UHS Modular Integrated Undergraduate Curriculum Physiology Dr. Sheen CEO and Founder Sheikh Zayed Medical College Physiology Department. Medical Superfast Simplified Physiology Video Lecture Notes. Guyton and Hall 14 edition chapter number 50 lecture number 2 page #631. Explain the mechanism of accommodation. Explain the mechanism of accommodation. Definition. The adjustment of eye to see near objects clearly. It is the process by which light rays from near objects are brought to a focus on retina, or the ability of the eye to change its focus so that clear images of either close or distant objects can be formed on the retina. Mechanism of accommodation. In children, the refractive power of the lens of the eye can be increased voluntarily from 20 diopters to about 34 diopters, which is an accommodation of 14 diopters. To make this accommodation, the shape of the lens is changed from that of a moderately convex lens to that of a very convex lens. In a young person, the lens is composed of a strong elastic capsule filled with viscous, proteinaceous, but transparent fluid. When the lens is in a relaxed state with no tension on its capsule, it assumes an almost spherical shape because of the elasticity of its capsule. About 70 suspensory ligaments attach radially around the lens, pulling the lens edges toward the outer circle of the eyeball. The tension on the ligaments causes the lens to remain relatively flat under normal conditions of the eye. Also located at the lateral attachments of the lens ligaments to the eyeball is the ciliary muscle, which itself has two separate sets of smooth muscle fibers, meridional fibers, or longitudinal fibers, and circular fibers. Contraction of either set of smooth muscle fibers in the ciliary muscle relaxes the ligaments to the lens capsule, and the lens assumes a more spherical shape, because of the natural elasticity of the lens capsule. Concept of accommodation. It is the process by which the eye changes its optical power to maintain a clear image or focus on an object as its distance changes. To make this accommodation, the ciliary muscle, when the ciliary muscle is relaxed, the suspensory ligaments stretch, the lens becomes thin or flattened for focusing distant objects. When ciliary muscle contracts, this reduces the tension on the suspensory ligaments attached to the lens. The reduction in tension, the suspensory ligaments, or ciliary zonules, relax, then lens curvature increases or becomes more spherical and refractive power increases, focal length decreases, and focus point becomes close, for near vision. The ciliary muscle is controlled by the autonomic nervous system, with sympathetic stimulation causing its relaxation and parasympathetic stimulation causing its contraction. This mechanism allows the eye to maintain a clear image on the retina whether an object is near or far.